When is a parent born? When your world changes in a moment? Nani? Or when the moment is celebrated by all? When you start learning again? Or with a new role? Is it your child's first breath? Or is it just a feeling? Parents are born when they fulfill a responsibility.
Your child's umbilical cord blood can provide protection from 80 life-threatening diseases. Keep it safe with Asia's largest stem cell bank, Cordlife. One chance, one choice.
Hi, everybody. A very, very good afternoon. Thank you for joining us today for this session organized for all the patients of Dr. Meera Agarwal and organized for you by Cordlife. Our sincere apologies for the slight delay in getting started, but now we are on track, and I hope that everybody is all ready and set. So just to kind of, let you know, again, as a reminder for the people who are coming in for the first time, all your microphones have been kept on mute and you will not be able to speak. However, we will be answering all your questions through the question box. So on your dashboard, there is a question section. Please put all your questions over there. That will help you to get all your queries and queries resolved, right? We are going to be together for approximately 1 hour and plus. So it is a good idea to make yourself super comfortable. So grab some pillows, keep a water bottle handy. Just take a minute if you want to grab a pen and paper to make some notes if you like, because we're going to be covering information for post-delivery. So you might want to make some notes as well. So just get everything organized and we will get started in just a minute. All right. So thank you, everybody, and a very warm welcome on this Sunday afternoon. As you all know, this session is a part of 3 sessions. It's a series of 3 sessions. The first session was done in the first week of January, where we covered nutrition and exercise during pregnancy. The second session was on the 17th of January, where we covered labor and birth preparation. And the third session is today, where we are going to be covering information related to breastfeeding and life after baby. This series of sessions is an initiative by Dr. Meera Agarwal. So a very big thank you to Meera ma'am for creating this opportunity for all of us. So thank you, ma'am. Thank you to all the staff at Agarwal Nursing Home who help us to coordinate this session. The platform has been arranged for us by Cordlife, which is one of India's leading stem cell banks. So a thank you to the team at Cordlife for taking this initiative. And even, in a situation where we have a pandemic, we are not allowed to be in the same room, large groups, etc. We're still able to conduct all of these sessions effortlessly. So thank you to everyone involved, and a big thank you to all the moms who are with us today and who are also part of the WhatsApp group where we've been sharing information with you, right? Myself, I should start with that as well. I'm Sonali, and for those of you who've attended the previous two sessions, you already know about me. But for those who haven't, I am a pregnancy and postnatal consultant based out of Mumbai. I stay and operate out of Bandra area. And I also run my own online portal. I've been in the process of conducting pre and postnatal sessions for 17 years now, and I've worked with more than 35,000 families. So on a personal note, I have two kids as well. And of course, they are much older. My son turned 20 last year. My daughter turned 18. So I have two adults. And I call myself a senior citizen nowadays. But anyways, all that is my background. So I'm going to get started first with breastfeeding, which is a topic which is very, very close to my heart because it's such an important aspect for the baby, so much important for the mother. And to help me, I obviously have my little friend along. I wish I could have a baby along. It would have made it more lively. But as you all know, babies can be very erratic, and so they might not allow a session to progress smoothly. So we'll use it all right? So let's get started. And for those of you who just jumped in, questions in the question box. Before I close the session, I will make sure I answer everything. So since I said I'm going to start with breastfeeding first, the first question that comes to mind is breast milk. Is it the right choice? If you look at the picture that I have on the screen, it is golden yellow in color and it's liquid. So it's drops of gold, which are visible on our screen. And that's exactly what we call breast milk. It's liquid gold. So it definitely is one of the best options as far as the baby is concerned. So we should consider giving it the best possible, at least start more than anything else, and not give up really soon. Breastfeeding has many advantages. As you can see on the screen, I've written 101 advantages of breastfeeding. And no, don't worry. If you're planning to switch off and like, no, I'm not going to talk about all of them, but I'll very quickly mention a few important ones. It's really important from the baby's perspective because the nutritional composition is perfect. The baby's system can digest it really easily. Because of this fact also, chances of allergies are way lower. From the baby's perspective, it helps to build immunity and also increase the IQ. So there are loads and loads of benefits as far as the baby is concerned. When the mother is concerned, of course, we definitely want to give some advantages for the mother as well. So let's talk about some of the important ones. It helps you to lose weight. It's the same hormone which initiates breastfeeding, which helps the uterus to contract. So it also helps you get a flatter belly. Additionally, it is going to give you protection against the hormone-related cancers like breast cancer, ovarian cancer, etc. And over and above that, it's super convenient and economical. Now, why do I call it convenient? It's the only food which is available at the right place, the right time, the right temperature, and the right quantity. Now, you really can't beat that, isn't it? Can you think of anything else? I'm sure you can't. As far as convenience is concerned, think about this. It's the middle of the night. The room is dark and quiet. Your baby just whimpers in the crib, and you pick up the baby and you quietly latch the baby on, and it's done. The baby is still sleepy. You've not left your cozy bed, and you can simply go back to sleep really soon. But if you were bottle feeding, you would have to get up, make the bottle, test the temperature. Till then, the baby would be wide awake. And to do all this, you would need some light as well, right? So then everyone wakes up and it kind of becomes a whole process. You're awake, you've left your warm bed, it's difficult for you to fall back to sleep. The baby is wide awake and you might need to comfort the baby back to sleep as well. So it kind of elongates those midnight feedings and makes feeding a process and a job, which is what we don't want. So keeping that in perspective is convenient. I know when I use the word economical and cost effective, it's actually free, right? But you might think that I'm comparing it only to the cost of formula, but I'm not. I'm actually comparing it to a lot of other things as well, which is, if the baby's immunity is good, the baby falls sick less, the baby will need to go to the doctor less, the baby will need lesser investigative tests, lesser medications. So you save a lot of that. Over and above that, if you're a working mother, if your baby is unwell, you might have to take leaves. So you will lose out on your salary too. So all of these are aspects which make it very, very cost effective and economical as well. So I'm sure that you're super convinced that breastfeeding is amazing, and I should definitely understand how to give it the best possible shot. And that's exactly what I'm here to talk to you about in the next 15 to 20 minutes. Here are a few things that you should know, right? The first thing is get started with breastfeeding at birth. So, for example, if you have, the baby's being delivered, what's going to happen is the baby is placed in your chest. Now, many times the pediatrician might want to examine the baby, and that's fine. So once the examination is over, ask for the baby to be brought back to you. So if you can have the baby skin to skin, it will also help because the baby is also very scared. The baby is in a new environment. You don't really want to dump the baby in a little corner, in a little warmer by himself or herself. You want the baby right here, isn't it? So ask for the baby to be brought back to you so that you can hold and you can cuddle the baby. While you're holding the baby, do try to latch the baby on. Babies take a lot of comfort in the suckling action, and that helps them to calm down, feel a little comforted, help their body temperature to regulate. It helps their heart rate to stabilize. They also hear your heartbeat, which is familiar. So it's something which has lots and lots and lots of benefits. So get started with breastfeeding at birth itself. And you can do this even if you have a surgical birth. Ensure that the baby is latched well. So when we're talking about the latch, let me show you what I mean by that. So that's a breast, and a lot of times what happens is the baby's mouth is small. So the baby might simply go, ooh, and then only the nipple goes into the baby's mouth, which makes no sense. So if you look at how the inside of the breast is designed, it has all of these little pipes, and they all culminate behind the areola. So if the baby latches on only to the nipple, the baby will get nothing. And if the baby latches on to about an inch and more of the areola, then only the right stimulation will happen. So the baby needs to be latched well. Encourage the baby to open the mouth wide, right? And when the baby opens the mouth wide, it will also not hurt you. So that will help you to prevent sore and cracked nipples. The third thing that you should always ensure is that you're not Mother India. You have to be comfortable. So the way when I told you at the start of this session, make yourself comfortable. So that's exactly what you need to do as well. Make sure that you're seated comfortably, take as many pillows as you like. That's something which is really important. If you feel that you want a breastfeeding pillow, that's great too. But if you don't have one, don't despair. You can use multiple pillows at home to make yourself comfortable. Your arms, your back, your shoulders, everything has to feel just awesome. The more you feed, the more milk you'll produce. That's a mantra that you should always keep in mind. And right in the beginning itself, the more you feed, the faster your milk flow will start. And therefore, it becomes really important that you keep feeding the baby really often. And nature has designed it that way as well, right? That baby is a little scared, baby is a little cranky, so you keep latching the baby on, and that ensures that you're feeding the baby often. You may be latching the baby for comfort, but it's actually helping the baby in terms of your stimulation as well. The last thing that I mentioned on this slide is the size of the newborn stomach. You know what? I'm just going to show you what it is. That's the size of your baby's stomach when the baby is born. Amazing, isn't it? So now, when you deliver your baby and you press your breast and you realize that you're making just a couple of drops, you should remember this little thing that I showed you, this little pea-sized ball that I showed you, which is the size of your baby's stomach when the baby is born. So you don't need to stress, fret, worry, be concerned, or listen to people telling you that, oh, you don't have milk. It's normal. 100% of mothers produce droplets of milk in the first few days, 2 to 3 days, and that's completely normal. Now, what can we do to ensure that we are increasing our milk supply? So in the beginning, this is normal, but what we need to do is ensure that we're feeding the baby 10 to 12 times in a 24-hour period. Sometimes when I write the word day, people seem to think it's daytime, but no, the baby's stomach is so tiny, the baby also needs to eat at night. So we're looking at 10 to 12 feeds per day. Make sure that the latch is correct. I have already shown you what happens if the latch is wrong. There's not adequate stimulation and the supply does not build up. If at all formula has been recommended for your baby by the doctor, please do not use a bottle to either give this formula feed, which is called a top feed, or expressed milk. So sometimes mothers might think that, okay, it's all right if I'm at least expressing and I'm giving my own breast milk to the baby, then I can use a bottle to give it. But this can cause nipple confusion because when the baby feeds at the breast, that's how the baby's mouth is. But when the baby feeds with the bottle, the baby's mouth has to go like that. So this versus this can cause a lot of confusion. And that's not something that we want to do. Another fact about the bottle is that it's absolutely free flowing, right? So as soon as you tilt the bottle, the milk starts flowing and the baby is going to get lazier and lazier because the baby will say, okay, I'm getting food, I'm getting to suckle, and I don't have to work. So why don't I just prefer this? Sometimes I've seen babies refuse the breast even after being given just 1 or 2 bottle feeds. They're that smart. Okay, you should drink plenty of fluids. We're looking at about 12 to 14 glasses in a 24-hour period. This could be things like water, maybe lemon water, buttermilk, coconut water, so things like that. Be positive. So stress and anxiety always will reduce your milk supply. So I always tell mothers this. There are 3 things you should remember if you're looking to make more milk. First is feed often. Second is make sure that you're having plenty of water. And the third is just smiling a lot because the more relaxed you are, the more happy you are, trust me, the more milk you will make. If you still feel that you have less milk and it's not building up, then after the baby has latched, express a little milk so that you can teach the body that actually more is required. So you're just sending that additional signal which will help the breast to learn that it has to produce more. Actually, this one's so logical. When we start weaning and we start giving other foods to the baby, breast milk automatically reduces. So I don't understand many times why mothers don't accept the fact that the only thing that is going to have to increase milk supply is more stimulation. So just stimulate more often. Here are some of the common concerns that mothers might face while breastfeeding. So in the beginning, on the first day, second day, when you touch your breasts, they might feel nice and soft and squishy. Suddenly, when the milk starts coming, the breast becomes hard, heavy, tight, and this is called engorgement. It's very difficult for the baby to latch on at this point of time, and that can be a challenge as well. So when the baby is latching on and the breast is tight, the nipple does not kind of, have any mobility. So then that becomes difficult for the baby to suckle. And then the baby is not emptying the breast, which leads to more discomfort. Sometimes mothers might also feel that they're developing a slight temperature or fever when they have engorgement. How do you deal with this? Take a warm compress, apply it on the breast, or take a nice warm shower Do a gentle breast massage in circular movements. Express a little milk if needed so that the breast becomes lighter, and then latch the baby on. Don't overexpress because that can teach the body to just simply make more. Express only to the point of comfort. Many times we're feeding on one side, the other side starts leaking. It's feeding time, but the baby is asleep, and ooh, suddenly I'm all damp. That's leaking breasts, and it's normal. It can happen quite often in the first few weeks, and that's why you can use breast pads. When you're using breast pads, make sure that you change them really often. Don't continue using the same one even if it's damp. So change it often, otherwise you'll breed bacteria, there'll be an infection, and that will result in a different problem altogether. After a few weeks, as the body learns the demand and supply game, the leaking breasts might stop. So don't worry, it's completely okay. I've had multiple times mothers calling up at 3 or 4 or 5 weeks post-delivery saying, my milk has disappeared. It hasn't. It's just that the body has learned how much it has to produce. Remember I said that it helps the uterus to shrink? So feeling period-like cramps in the abdomen is very normal. And you should actually feel happy, because if you're getting that little cramp sensation when the baby latches on, it just says, yay, I'm getting a millimeter thinner in this feed. And that's perfect, isn't it? That's a positive way of looking at things. Sore nipples, I've already spoken to you about. The leading cause is, the incorrect latch. And then, as I told you, if you do not change your breast pads often, you can get an infection, and this can also result in sore nipples. Tingling in the breast, you've seen the ducts, right? The little pipe ductal structure that is there. So as the milk flows down it, it's very normal to feel that tingling sensation, and it's completely okay. Every day in the morning when you're taking a shower, do a self breast massage. Please do it really gently. It's nice circular movements all over the body of the breast, and then gentle strokes towards the nipples. It just takes a couple of minutes, but it will help to ensure that your ducts remain clear and you don't form lumps. If lumps form and we don't take care of them, then they can get infected, and then you need antibiotics and all of those things. So then that becomes a breast infection. So we definitely want to ensure that all of these issues don't come up during breastfeeding. It's not that they are regular, they are rare, but if they do, they can be a huge issue. So be alert, be aware, and reach out for help if you are having any breastfeeding problems, even after you have reached home. Today's mothers have always asked this question: what can I step out, but I still want to breastfeed my babies? Can I store my milk? And yes, the answer is, of course, you can express and you can store. So if it's going to be for a short requirement, then it can be just kept at room temperature for about 4 hours and at about 26 degrees centigrade. So that's your indoor temperature. You can keep it in the refrigerator, which is maintained at 4 degrees centigrade for 48 hours. You can keep it in the deep freezer, which you've set to a -16 for 3 months. Now, the reason why I have a fourth category is out of a special freezer for 6 months, because what happens is that our regular freezer at home does have other things in it. So we constantly open and shut it. An average freezer will open 3 to 4 times a day. So that is going to keep changing the temperature slightly. And that's why we want it to be in a special freezer if you're going to do long-term storage. So a lot of times this question also comes up. It generally comes up from the older people in the family. Is it safe? Can I keep it for like 3 months? Is it still nutritionally sound for my baby? And of course, the answer is yes, it is. And as long as you've stored it correctly, you've expressed it correctly, and then you are thawing it correctly, you really have no problem, and you can safely use it for your little one. Here are some suggestions on how you can express breast milk. You can express manually by hand. So that's for occasional mothers who want to just once in a while want to express some milk and don't want to make an investment into pumps. You can use a manual breast pump or you can use an electronic breast pump. Here's how you would manually express. You're going to place your thumb and your forefingers right here outside the areola. Start with one section. The first movement is pushing back against the chest wall and then compressing, right? So it's push back and compress, push back and compress, right? When I'm done with this section, I can move my hand a little bit and do the other section. So it's push back and compress, push back and compress, right? Don't only press on the areola. It has to be just a little bit outside the areola. A manual breast pump is also great for occasional use. Once in a while, you want to step out for a date with your husband, then this can be really, really helpful. Cost effective, and of course, it definitely, has no parts which could get spoiled, so it's not mechanized. Some parts can break and get spoiled, but the chances are much lesser. So it's not mechanized, and that can be very, very easy to manage. So if you want to occasionally express, you can use a manual breast pump. Here I have first on the left side of the screen, this one is a single electronic breast pump. This is just a representative image. You can pick any brand that you like, but here's what you're looking for. Your pump, whichever one you're taking, should have the on and off button, which is, of course, one of the important aspects. So you have the on and off button, and then you put this on, and that's your stimulation phase, right? So you have your stimulation phase for about a minute or so, and then you're going to press this button, which is your milk ejection button. So you're going into phase 2 of the pumping cycle, which is called milk ejection. Now, once you're here and you press this button, the pump process will change and you will feel the suction is a little different. Now, what are you going to do? Can you see this plus and this minus? So we'll start with the plus, because once you press this, you are at level 1. So we'll take it to the second level. So we go to the second level with the plus and we see how it feels. If it feels comfortable, we're good. And then we go to the third level. We press the plus again and again and again till we reach a point that we feel that, okay, this is hurting me a bit. So then you drop back and go to the previous level. That's your level, right? Every mother is different, and we don't need to so my friend pumps at level 5. Why can't I get to level 5? It's not a competition. It's your body and how your body prefers it. So that's perfectly all right. When you're done with pumping, when the milk stops coming, it's just gone down to like reluctant drops, then you're going to stop. But don't just press, don't just press this button here, right? You just go minus, 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 bring it down to level 1 and then press stop, so that you don't shut it off with a bang as well, because it's, again, your body, right? For mothers who are expecting twins, for mothers who know that they have to go back to work really soon, sometimes, we have professionals and they want to resume work at about a month postpartum. I know I did, right? So if you're going to be away from the baby multiple times and etc., then a double breast pump might prove very effective for you, because it will be faster. It's a little bit more expensive, but it's definitely faster, and it will get your job done much more better. So is pumping painful? No, not at all. If you pump the way I showed you, all the different things, it is not painful. Is it time consuming? It will take the same amount of time that it takes the baby to feed. So from that perspective, well, not really. So the advantage that happens is that you can at least step away if needed. If you are a working professional, you have that as an option. If you need some work done, some me time, that also is an option. So it's definitely something worth exploring. So I'm going to move on to your new baby. These are a few things that we require when it comes to shopping for the baby, right? So the first suggestion would be that decide on sleeping arrangements for your little one. Your baby needs to kind of, there are various ideas. You could bed share, but that's not recommended by most organizations like the Indian Academy of Pediatrics, the American Academy of Pediatrics. The recommendation is that you should not bed share because your baby is still small and there is a chance that your covers and your hand and your body might come onto the baby. The second option is room share, but in a separate bed. So that could be a bassinet or a cot. You'll have to arrange for that. It has to be close to you so that you can access the baby easily from your bed. Or it could be a separate room, but then you'll need baby monitors. So you decide on what works for you and your family and accordingly make your decision. The next thing you're going to buy is all the clothes. Babies don't need a lot, right? But they definitely need some cloth nappies because we want to know how much the urine count is. So many times from the lactation perspective, we would ask mothers to use a cloth nappy for a few hours so that we get a count of the number of times the baby has urinated. You will need some diapers, which is also helpful for traveling, for sleeping, for times when you're exhausted. And that's okay too, right? You can definitely use a diaper at those times. It's okay to use a diaper 24/7 also. It's not that diapers cause a rash or nappies don't cause a rash. So just use whatever you're comfortable with. Babies come from the womb where they are warm and cozy and snug, right? So when you swaddle them and you swaddle them lightly, they would be more comfortable, and they also have what is known as the shirking reflex. So babies tend to do this a lot, and we feel that they're either scared or cold, but it's just that they have a shirking reflex. Medical term is the Moro reflex. So swaddling them lightly can help them to sleep better, and it can also control the shirking reflex. So it's not harmful, but it just wakes them up. So that's harmful for the parent who's done so much work to put the child to sleep. Okay? Caps, mittens, and socks. If this is a Mumbai baby, then they're really something which is only for show. We don't really need to bundle up the baby because our weather generally is never that cold, right? You must decide on bathing equipment for the baby. From our end, our recommendation has always been that no outside person to bathe, massage the baby, right? So make sure that you think about bathing equipment. There are lots of options available in the market where there are comfortable little bathing chairs for the baby, which can be fitted into a baby tub. So you can invest in something of that sort so it becomes safe, easy, and convenient for you to bathe your little one. You might want to also have a massage mat so that you can do some gentle massage for your baby yourself. Massages for bonding, massages for touch therapy, massages to feel good. And honestly, massage can also help your baby to sleep better, right? So you can do massage yourself at a time when you and the baby are both comfortable. So what you need to do is, use very little oil or lotion only on the baby's body, not on the baby's face, and use very gentle strokes. So if I were to explain to you, take your 2 fingers and gently massage your eyes. That's the kind of pressure and stroke that you have to use when you are massaging your newborn, right? Massage can be short, massage can be long. Massage can be once a day, 4 times a day, or not even once. So it's a very personal preference and choice. You might want to pick up some hygiene items like soaps and shampoos, and all babies are born with long nails. So buy some good nail cutter or nail cutting equipment. Additionally, a lot of parents like to buy a carry cot. I don't think that's really essential. The best way to carry a baby is in your arms in a baby wrap. So there are lots of brands which are available now, which are baby wraps for even a newborn. and you should consider getting one of those because it's a lot of skin, warmth, and the baby feels very comforted. The baby is more calmer. It just makes life a lot more easier. Or you can also look at a pram, but again, if this is a Mumbai baby, think about where you're going to take that pram because our roads are really not designed for anything of that sort at all. These are some of the concerns that you might have as far as a baby is concerned. So let's look at these things one by one. A newborn's head looks like this. It's a little pulled out, it's a little conical, it's a little, as if it's long. It's a little longish, and that's completely normal. Please don't do any massages or patting or all of those things to try to shape the head. That's not required. This happens because of life in the womb. This happens because of the passage out of the birth canal. So it's completely normal and we don't need to worry about it at all. Babies have a lot of hair on their body. This is called birth hair. Please don't use Uptons and etc. to try to remove this. This is birth hair and it will fall off on its own. Many times parents also send very concerned messages that their baby is losing the hair on the head. I mean, we are such funny human beings, right? We worry about too much hair on the body, but if there's less on the head, we're really concerned. So don't worry, the baby's hair from the head will also tend to fall off, and you might realize the baby has a little less hair than what the baby was born with. And for the first year or so of life, newborns have scanty hair. So it will become thicker and there's no problem at all, right? So in the beginning, hair is scanty for the first 12 to 18 months, and then it slowly starts becoming thicker. No applications are going to help. Mundan, cutting off, shaving off all the hair is not going to help. So it's a natural physiological process. Babies are born a little cockeyed, which is completely normal. It looks as if one eye is looking left and the other eye is looking right. The eye muscles are still not fully developed. Their vision is also just 8 to 14 inches, which is normal, right? Which is completely natural. So we don't need to worry about that as well. So don't worry, just relax. It's something which will settle on its own. Try and kind of, play games with the baby, use rattles to help the baby look from left to right, keep baby in different angles, talk to baby from different angles. It will encourage them to move their eyes and thus develop their eye muscles. A little bit of staining of blood on a baby girl's diaper is completely normal in the first 8 to 10 days of life. This is what your baby girl's first period looks like. A few drops of blood, which will happen 2 or 3 times. There is nothing to worry about. It's completely normal and natural. It's a physiological process. It's the uterus kind of saying, hey, I exist. And you don't need to panic or worry about it. The umbilical cord is cut for you at birth, and you are also going to have a little plastic clip which is put there, which kind of looks like this. Now, when this falls off, so it's going to fall off at this point, right, at the umbilicus end, then everything will be off. At the time that it falls off, there will be a little bit of spotting, a little bit of soreness, which will be there in the umbilicus area, which is normal. And till then, till the stump is healing, try and avoid covering it with a nappy or diaper. Try and avoid any applications on it and keep the area dry. That's very, very important. Colic affects a lot of babies and they tend to cry a lot, right? They cry at the same time every day and they're inconsolable and we don't know what's happening. And then suddenly it just disappears and then they're smiling again. And you wonder what happened. Some babies will get colic as early as 2 weeks of life, and it may last for about 3.5 to 4 months. What's happening is that the stomach, the intestine is still developing and the baby is just learning how to digest foods. And when I say foods for a baby, it's breast milk or formula. So the digestive system is just starting off, and therefore the babies get a little bit of colic. So there's no long-term side effect to it, but the short-term impact is that babies are crying, babies are fussy, they can't be consoled, and parents are going crazy. I mean, you get so scared as to what is happening. Don't give any ghar ka nuskhas, like, I'm giving gripe water or I'm giving hing and, all of those things. Don't do that. Do whatever your pediatrician tells you. So if you've identified that my baby is crying at the same time every day for no rhyme or reason, and nothing that I do is calming and comforting my baby, then it is possible that the baby has colic. So from that perspective, you will help to speak to the doctor and get the right prescription of drops. The reason I'm saying no for gripe water is because there are a lot of brands out there which actually have a little bit of alcohol in it as well. And you may not be able to understand the label really well. So you really don't want to give alcohol to your baby, isn't it? These are some emotional changes that can happen in the mother. So we have baby blues and we have postpartum depression. Baby blues are considered normal. Generally disappears in about 2 weeks post-birth. But if it's more severe and it is postpartum depression, then it can last longer than the 2 weeks period. There are mild ups and downs, weepiness and stress, etc. In the baby blues, but that's like mild, and most of the times you seem to bounce back. But in postpartum depression, the symptoms are much more severe and might appear irrational. So, you're crying, you're just like, moody all the time. You're just not communicative. So, I mean, nothing's happened, but you're still behaving, really weird. Baby blues don't need medical help, but postpartum depression can need some special counseling. And it's okay to, seek help. It doesn't mean that you're like, crazy or something like that, that if you need a psychologist, it's just to get some help. And it happens because of your hormones. So it's very important that you definitely seek help. We have seen that mothers who go through postpartum depression, it affects the baby as well. So if not for yourself and if not for your family, at least for the overall well-being of your baby, you should seek some help. This is a slide which your family members should also see because, many times mothers are not able to understand what is happening or express what is happening. But when an outside person, like, maybe your husband or your mother, looks at you from an objective external purpose, they might realize, oh, these are things that need to be attended to. If it's baby blues, you just need some rest, you need some good family support, and overall a cheerleading team, which kind of gives you an atmosphere of positivity. So with the postpartum depression, all of these things are also required, but sessions with a therapist who understands postpartum depression are really, really helpful. Moms are going to be sleep deprived. Accept it. If you're going into pregnancy and parenting thinking that life is going to go back to normal, it's not. It's really not. It's taken us 10 months and we're still not back to normal, even with COVID, isn't it? So as far as babies are concerned, trust me, I just told you in the beginning of this session that I'm a mother to 2 kids. And I still think my life has changed. It's changed for the better. But that's because I have accepted that, life has changed. You're going to be exhausted because you're taking care of full-time demands of a newborn and who can't communicate, who can't speak, who can't, you don't know what is happening. All the baby's doing is crying or peeing or pooping or feeding or needing to be put to sleep. So, well, lots of things, right? You might have irrational, you'd be irritable due to the hormonal aspects. You might feel overwhelmed. You might be feeling that, oh my God, I can't do this. What did I sign up for? And that's completely normal. I still feel that sometimes where I feel that, really, was I so stupid? But then it kind of feels that, no, it was all worth it. You also have a little bit about the body image, right? And trust me, all women do. I remember myself, right? Every 3 to 4 days post delivery, I used to pull out my pre pregnancy jeans and put them on to see how much more, right? So, well, I was doing it for fun. Fortunately, I didn't have any depressive tendencies. I was just like, hey, this is my goal. I need to get at this. But body image becomes really important. Your breasts are so large, they're leaking, they're achy. Your abdomen is all flabby. You don't feel like dressing up. None of your clothes fit you. So yeah, that body image is something which is very natural. There might be a lack of sexual interest as well, which is normal. I mean, hey, who's going to feel sexy with a contraceptive sleeping in the same room, or a baby who's latching onto your breast all the time? You never know when the baby's going to wake up. Also, the pregnancy and postpartum hormones are going to make your vaginal area really dry. So this can also need a little bit more help and support in terms of maybe a lubricant or extra foreplay to help you to feel the same level of intensity as it was in the pre-pregnancy phase. Here are some quick tips to ease the transition to parenthood. Read, read, and read. It's very important. Keep yourself abreast of all the information so that you are not feeling lost and overwhelmed. Ask questions. It's always worth it. Ask questions from doctors, peers, family members. Make your own decisions. That's really important, right? You are the parent and you are going to need to take responsibility. Talk and discuss your feelings and expectations, especially with your partner. Don't expect people to understand things. That's a big mistake, right? So let your partner know. If your husband's sitting and watching television and you really need some time to go take a nice warm shower, he's not going to come to know that. So you have to tell him, hey, listen, here's the baby. I'm going to take a hot shower. And that's important, right? Plan for some help. Don't aim at doing everything yourself. So whether it's family or you want to kind of, have a nanny, it's a good idea to get some help. You don't need to feel guilty about it, and neither do you need to become Mother India, which says that I'm going to do everything on my own for my baby. Doesn't sound great, right? Plan in advance and prepare for emergencies. You never know, right? So always have a backup plan in place. Don't blame yourself or your spouse or your family if all doesn't go as per plan. Because babies are unplanned in their routines, right? I mean, you might have a baby with a perfect routine for like 5 days and you start thinking, oh, this is great, I'm settling. And on the 6th day, the routine is completely different. So that's normal. So be prepared. And very important, set aside me time. So meet your friends, maybe, go to the spa, read a book, watch TV, take a hot shower. That's your me time. Do things that you enjoy. And do not forget to spend time as a couple as well, because you are a couple first and parents later. So, having a conversation about how many times the baby peed and pooped and did not sleep is okay. It's going to be part of your life as a couple. But the other things that you used to discuss, whether it was politics or your own business or your aspirations or planning for the house, those are also things that you should be doing often too. Let's show you a little video from our...
When is a parent born? When your world changes in a moment. Nani? Or when the moment is celebrated by all. When you start learning again. Or with a new role. Is it your child's first breath? Or is it just a feeling? Parents are born when they fulfill a responsibility.
Your child's umbilical cord blood can provide protection from 80 life-threatening diseases. Keep it safe with Asia's largest stem cell bank, Cordlife. One chance, one choice.
And here's a special surprise for all you mamas. From Mama Earth and Cordlife, here's a special gift voucher. Mama Earth is a brand which is made of all natural ingredients for skin and hair care. And you can actually buy maybe, some body lotions, scrubs. You could buy some natural massage oils for the baby. You could get some nipple butters. There are a lot of products that they have in the maternity and baby care range. So head on over to the Mama Earth website and choose your favorite products, because this gift voucher is coming your way and you can go shopping. Isn't that fun? After this session, in about 48 to 72 hours, someone from the Cordlife team will be in touch with you. And they're going to be giving you the details of how you can avail of this voucher. So make sure you attend to that call. They will also share the recording of this session with you. So again, that becomes an advantage that you can then refer to the session at a later point if you like. And if you would like to understand more about stem cell banking, take the opportunity and book yourself a presentation so that you can understand for yourself what stem cell banking is all about. So that's something which can be done either at your home with your family members, or it can also be taken as an online presentation along with your family members so that you can stay safe as well and you don't expose yourself to more people. So in about 48 to 72 hours, this will be taken care of. These are some books which are available on Amazon and have been written by me. So the first one is Prenatal Fitness, which is exercise nutrition for pregnancy and the post-delivery period. I actually have more than 100 exercises with pictures and explanations, diet charts, etc. in this book. So grab your copy today. Then there is Parenting Mantras, which again is all about parenting. So it's a quick read and it's got a lot of solutions to everyday parenting concerns like breastfeeding, sleep scheduling, toilet training, and etc. So that's a must-have for every parent. When your child starts eating, we have a recipe book as well, which is called Super Mom's Recipes. So all of these books are available on Amazon and you can get your copy today. I am now going to open the floor to questions. But before I do that, these are my personal details, my Facebook and Instagram handles. I do a lot of fun stuff in these areas. Like right now, for example, today, we're doing an Ask Me a Question day and we do giveaways and etc. So it's a great place to stay in touch. I have a channel on YouTube where I post a lot of videos. The last video that I posted, I have shared the link in the group this morning. So make sure that you subscribe to the channel so that you keep getting the details later as well. I'm also sharing all the Cordlife numbers here on the screen. So you have a toll-free number, you have a mobile number, a WhatsApp number, as well as an SMS number. So whichever one suits you, quickly grab that pen and make a note so that you can also remind them to give you your gift voucher and the recording of this session, right? So I'm going to open up for questions next, and I hope there are a lot of questions for me. All right, so what is the difference in the content of artificial and breast milk? So breast milk is made by the human body, and it's of course got all the proteins and fats and carbohydrates, everything that needs to be fed to the baby. The difference is predominantly in the composition. So when we are making artificial milk, we don't have a source, we have to use cow's milk for it. But we do modify it and we make sure that it is more suitable and designed for the baby's gut. And therefore, it's considered to be okay more than anything else if breast milk is not an option. But because it is an external product, it can definitely cause infections. It can have an allergy reaction. It has to have some amount of preservatives and sugars, etc. So the first choice would always be breast milk. So express breast milk, if it's for a short duration, you can store it in the same baby bottle. or even if you're keeping it in the fridge, you can keep it in the same bottle. But while feeding the baby, you should empty it into a container and feed with a spoon or a bondla, parada, or a medicine dropper or a syringe, but you should not use a bottle. If you think that it's, you need the bottle again for expressing and you want to continue the storage, then you can store in a steel container. You also have milk bags which are available in the market, and you can store it in the milk bags too. So milk bags are generally used by mothers who are doing long-term storage, who want to kind of, stockpile their freezer. So then milk bags become really handy. Glass containers should not be used to store breast milk because the white blood cells that are there in breast milk will stick to the glass. And then it becomes very difficult to mix it up back into the breast milk. It gets left behind in the glass container. So avoid using glass containers. As you all know, we've also reached the last session in this series. So we would really like to get some feedback from you on what your experience has been, if you've enjoyed the sessions, if they've been helpful. So especially from the mamas who've attended, of course, if you've attended only one, please give me feedback for that as well. But if you've attended all of the sessions, I would really love to hear from you as far as the choice of topics, how complete did you feel the sessions were? Were they helpful? So would really love to hear that. So you can also actually look up my website on Google, and I would be happy to get a Google review as well, or a Google feedback as well. And I'm sure the Cordlife team would also like to hear, so they might be having an option where you can, give them feedback too. Thank you, Sonal. Thank you, Nikita. That is really, really helpful. Little bit learning even we like to do, right? I mean, we also want to know how we can improve and make ourselves better. Would anybody have any more questions? Anything else that you would like me to answer? Even maybe something connected to a couple of the previous sessions that we did? All right, so then thank you everybody for taking out such valuable time on a Sunday afternoon. I know it's family time and it's precious, but thank you for spending your Sunday afternoons with me for these 3 sessions. I am really, really privileged. Thank you. Have a great pregnancy, have a safe pregnancy, and we look forward to getting all the good news from your end really soon. Thank you and bye-bye.
Bye, ma'am. We are ending the session then. There is no question anymore.
Yes, thank you.
Okay, ma'am. Thank you, ma'am.
When is a parent born? When your world changes in a moment. Nani? Or when the moment is celebrated by all. When you start learning again. Or with a new role. Is it your child's first breath? Or is it just a feeling? Parents are born when they fulfill a responsibility.
Your child's umbilical cord blood can provide protection from 80 life-threatening diseases. Keep it safe with Asia's largest stem cell bank, Cordlife. One chance, one choice.